Hello friends, welcome to my channel. This is Abhirami and I am here to discuss with you about today's topic, that is enzyme inhibitors, and today we will be discussing about the definition of the enzyme inhibitors, significance, importance of the enzyme inhibitors, types of the enzyme inhibitors, and then the comparative inhibitor and also the examples. So the definition of enzyme inhibitors is that enzyme inhibitors inhibit the activity of the enzymes. They inhibit the catalytic activity of the enzyme, and thus the products are not formed from the substrates. And the enzyme inhibitors can be natural or artificial, and there are majorly two types. They are reversible enzyme inhibitors or irreversible enzyme inhibitors. Now let's talk about the significance of the enzyme inhibitor. The enzyme inhibitors help us to learn information about the substrate specificity of the enzyme and also the role of the functional groups in the active site of the enzyme, and also the mechanism of the enzyme activity. Okay, and the enzyme inhibitors also help us to learn about the catalytic pathways in the cell, and one of the most important things about enzyme inhibitors is that they have a therapeutical application. So some enzyme inhibitors are used as drugs, antibiotics, toxins, and antimetabolites. So now let's talk about the types of enzyme inhibitors. There are two types, as I already mentioned, reversible inhibitors and irreversible inhibitors. Under reversible inhibitors, there are three subtypes. They are the comparative inhibitors, non-comparative inhibitors, and uncomparative inhibitors. And under the irreversible inhibitors, there are two types, suicide inhibitors and group-specific inhibitors. So now let's talk about the reversible and the irreversible inhibitors. Reversible inhibitors are bound to the enzymes by non-covalent bonds. So they are loosely bound, so they can be removed easily from the enzyme. So if the reversible inhibitor is physically removed from the enzyme, then the enzyme activity is restored. Okay, so but it's not the case with the irreversible inhibitor. In an irreversible inhibitor, the proteins, that is the inhibitors, are tightly bound to the enzymes through either a non-covalent bond or a covalent bond, but they are very tightly bound to the enzyme. So they dissociate from the enzyme very slowly, and that's why they are called as irreversible inhibitors. Okay, so now let's talk in deeply about the reversible inhibitors. As I already told you, there are three types under them: competitive inhibitors, non-competitive inhibitors, and uncompetitive inhibitors. Today we will be discussing about competitive inhibitors and the examples of the competitive inhibitors. Okay, so competitive inhibitors resemble the substrate. Okay, they resemble the substrate, so they are the structural analog of the substrate, and they bind with the active site. So they don't allow the substrate to bind with the enzyme. Instead, they bind with the active site of the enzyme. So that's what I mentioned here. So E is enzyme and S is substrate and I is inhibitor. So E plus S will give enzyme substrate complex, which will further give enzyme and the product. But this is stopped when there is an inhibitor. So the inhibitor acts with the enzyme and forms enzyme inhibitor complex, which cannot produce the product. So this can be changed only if the substrate replaces the inhibitor. So because of this, the rate of the enzyme activity, the velocity of the enzyme activity decreases. So because the inhibitor is present, the rate of the enzyme activity decreases. So this can also be reversed. I'll tell you about that in a minute. So first we'll talk about this graph. So this is the substrate concentration and this is the velocity of the enzyme activity. Okay, so when you plot a graph between these two, they give this sort of a graph, and here this graph is the one without inhibitor. Okay, this is the one without inhibitor, and this graph is the one with inhibitor. So at the starting, when the substrate concentration is very low, the velocity of the enzyme activity is also very low. But as the substrate concentration increases, the enzyme velocity also increases steeply, and then at one point the enzyme substrate complex formed is equal to the degeneration of the enzyme substrate complex. So the synthesis of enzyme substrate complex is equal to the degeneration of enzyme substrate complex. So that is where the curve stabilizes. Okay, and this point is called the Vmax. So after this point, even if the substrate concentration is increased, there won't be any increase in the enzyme velocity. So this is called the Vmax, and at half of the Vmax, if you take the concentration of the substrates at half of the Vmax, it is called Km. Okay, Km is also called as Michaelis constant, and for normal reaction, normal enzyme catalytic reaction without inhibitor, this curve is the one, and as you can see, the Km is less for that curve. But with the inhibitor, what happens is the Km gets increased, but the Vmax stays the same. So why this happens is, for a comparative inhibitor, since the enzyme velocity decreases because of the inhibitors, we need to increase the substrate concentration. So let's say there are about 100 enzymes and 100 substrates and 100 inhibitors. Then 50 substrates will bind to the enzyme and 50 inhibitors will bind to the enzyme. So this will reduce the velocity of the enzymes. But what happens if there are 900 substrates and 100 inhibitors for 100 enzymes? That means that the substrates will bind more to the enzymes than the inhibitors will. So that's how we can reverse the comparative inhibition. Okay, so and this is how the Km value increases, because you're increasing the substrate concentration for the same velocity. With the inhibitor, the Km value will increase, but the Vmax will remain the same. Okay, now let's talk about the examples of the comparative inhibition. So the first is the mevinolin and lovastin. Mevinolin and lovastin are drugs which are inhibitors, and they inhibit the enzyme HMG-CoA reductase, and HMG-CoA reductase is involved in the biosynthesis of cholesterol. So that's how the cholesterol level is lowered. So actually people with hypercholesteremia, that means high level of cholesterol in the blood, for them cholesterol needs to be lowered. So to lower the cholesterol, they take the drug mevinolin and lovastin, and this will inhibit the HMG-CoA reductase, which is a rate limiting enzyme of the biosynthetic pathway of cholesterol synthesis. The next one is the allopurinol. Allopurinol is a drug that is given to patients with gout, and the allopurinol competitively inhibits the enzyme xanthine oxidase. And the next one is methotrexate, which is given to people with cancer, and it competitively inhibits the enzyme dihydrofolate reductase. And the last one is captopril and enalapril, and it is given to people with high blood pressure, and it inhibits the angiotensin converting enzyme. Actually, how this works is that we all know the renin angiotensin aldosterone system. So the renin is produced by the kidney, and it converts the angiotensin produced by the liver into angiotensin 1, and the angiotensin 1 is converted to angiotensin 2 by the angiotensin converting enzyme, which is produced in the lungs. The angiotensin 2 will cause production of norepinephrine. Norepinephrine will increase the blood pressure. It will also stimulate the production of aldosterone from the adrenal cortex, which will increase the reabsorption of water and sodium ions in the kidney. The angiotensin 2 will also cause thirst by acting in the hypothalamus. So the renin angiotensin aldosterone system is inhibited by inhibiting the angiotensin converting enzyme, and that is how blood pressure is lowered, because the angiotensin 2 causes high blood pressure. Now I'll go ahead with more examples. Now let's continue with the examples of comparative inhibition. So sulfonamide is a drug which is an analog of PABA, okay, para-aminobenzoic acid, and sulfonamide is an analog of PABA. So it is similar to the structure of PABA. It inhibits thyroid synthetase, which is an enzyme which is required for the synthesis of the folic acid, and this folic acid in the microorganisms. Okay, so folic acid, so microorganisms produce folic acid, and thyroid synthetase is the enzyme that is required for this, but sulfonamide inhibits the thyroid synthetase because it is a structural analog of PABA, and this causes the pathogens to die. The next example is dicumarol. Dicumarol is actually an anticoagulant, and dicumarol is a structural analog of the vitamin K. So dicumarol is a drug which is an anticoagulant, and it is a structural analog of vitamin K, and actually in the hepatic liver cycle of vitamin K, there is an enzyme called epoxide reductase, and vitamin K inhibits this enzyme. Okay, so vitamin K inhibits epoxide reductase, and since dicumarol is a analog of vitamin K, it can also inhibit epoxide reductase, which is involved in the blood clotting. So it inhibits the prothrombin formation, and this is used in the treatment of thrombosis. Thrombosis means intravascular clotting. So it is used in the treatment of thrombosis, and on earlier days they were used to delay the blood clotting. Ibuprofen and statin. So ibuprofen is an anti-inflammatory drug, and statin is a anti-cholesterol drug, and they also act as comparative inhibitors, and they help in lowering the inflammation and cholesterol respectively. So that is all about the comparative inhibition, and next I will be putting videos on the other parts of the enzyme inhibitors, like non-comparative inhibition, uncomparative inhibition, and the irreversible inhibitors. Thank you for listening to me. If you like this video, please like, share, subscribe, and comment on it. Thank you.